So let me tell you why we're having these Lyme Hangouts. The Lyme Hangout is that there is so much happening in Lyme. We're all learning about Lyme. I'm involved in Lyme all the time in my practice, but my favorite activity is to read the literature, read an article, reflect on what an article tells me about Lyme disease. And I'd like to share that article with you. So I was starting to share those articles on the All Things Lyme series. So you're probably wondering, why did I pick an article today to read about neonatal children with Babesia? And it'll become clear to you why, even though I take care of adolescents and adults in my practice, why this is a fascinating article. And I'm hoping that you will enjoy this article and see where it fits into your life. So on my book, Lyme Disease Takes on Medicine, I picked this particular article, so I wanted to read a few words from this case. The title is called "Blood Donor Infects Premature Infants with Babesia." So I start out by saying Babesia is a parasite which infects red blood cells, causing symptoms similar to those seen with malaria. It typically is transmitted by tick bite, but can be acquired through contaminated blood transfusions. The disease can be challenging, difficult to recognize in adults, so can you imagine the challenge of diagnosing it in a premature infants? A team of researchers at Yale School of Medicine described 3 premature infants, all in one neonatal intensive care unit, who contracted Babesia from a single 24-year-old blood donor. The report was published in a pediatric infectious disease journal. So what I'd like to do is put the book aside for a minute and go into a couple things from the PowerPoint presentation that might help explain it. The title is "A Cluster of Cases of Babesia microti among neonatals traced to a single unit of donor blood." And it's by authors from Yale in the Pediatric Infectious Disease Journal. So in the last hangout, I explained how Babesia can be serious, can increase the severity of Lyme disease. So the two together makes it worse. You can get Lyme with risk factors like age, but you can also get it without any risk factors. You can be symptomatic with Babesia for years sometimes. It can be difficult to diagnose because there is a blood test called a thick smear, where you look at the red blood cells. You can do a test called a PCR and an antibody test. And it doesn't seem like everybody has a positive test. It requires different treatment than doxycycline. You have to treat with something like Mepron and Zithromax for parasites, and it can be transmitted by ticks and blood. So just to explain the first infant in a little more detail, can you imagine having a baby that's born prematurely at 26 months, 4 days of gestation with all kinds of medical problems, which are pretty typical for a newborn that's premature, like respiratory distress, hemorrhage, retinopathy, thrombocytopenia, and anemia at prematurity, and they require blood, which is fairly common at day 2 and day 5. And on day 22, that means about 3 weeks later, a routine blood smear was noted. And fortunately, the doctor noticed that in the red cells, there was Babesia. In fact, 9.7% of the red blood cells had parasites in them. So they normally would use quinine and clindamycin because that's what the original research said it should be used. But they couldn't be sure that they could suspend the quinine. And they weren't sure because quinine has plenty of side effects. So with doctors, they always have to make judgment, the best judgment they can, and so they treated with azithromycin and trovaquone for 14 days. So let's get let's discuss that case for a minute. So when you look at cases like this, is that you always wonder, when do people get Babesia? How long does it take to get sick? In this case, it took 3 weeks for the baby to get sick from the transfusion to when they showed up with Babesia. The other thing that was rather alarming is that when you look for Babesia, look for symptomatic Babesia, it's often complicated because Babesia is asymptomatic in some patients and symptomatic in other patients. And in this particular child, fortunately, the doctors were able to recognize through the pathologist's observation that there shouldn't be parasites like Babesia in the red blood cells, and they were able to use their clinical judgment. Now, there's always a discussion of asymptomatic Babesia, but it's very hard to look for symptoms in a baby that's premature because a lot of the time they can't complain. They can't explain symptoms anyway, and their physical findings are very similar. So it just shows you the challenges we all face with Babesia as adults, as adolescents, but also in this neonatal intensive care unit. The other thing is that doctors often go to treatments that have been first reported in the literature, like the quinine. It's just that quinine may be difficult in some cases to tolerate. In this case, they made a judgment to go to a better tolerated drug, and fortunately, the baby tolerated it. So it reminds us how important Babesia is, and fortunately, the baby got treated. The other thing that was very important is that the doctors went out and looked at where did this Babesia come from? Where did that Babesia start from? And they were able to identify the donor. That brought them back to what happened to the rest of the blood. And so if I share the screen again, that they were able to take that one case and infant B received blood from the same donor. At 24 months and 2 days, the baby was presenting with respiratory distress syndrome, anemia, prematurity, got blood at day of life 2. They'd been alive for 2 days, and day of life 5. The smear didn't show anything at day 14, but at day 27, both the thick smear showed the parasites, and there was DNA called PCR. They showed the DNA of Babesia. So the parasites in the red blood cells were detectable. In fact, 12.5% of those red blood cells were infected with parasites. And the other fascinating thing about this second baby is this reoccurrence, because you always wonder for sure, is Babesia gone? Have we resolved Babesia? Lots of doctors will revert back to the 10 days of treatment for Babesia because that was the first study by Krause. 10 days seemed to work, but there's always uncertainty in medicine. How do you know an infection is cleared? In this case, the infection didn't seem to clear. The infection showed up at day of life 89. Still, the baby was pretty young because they were born at 24 months. In this case, the doctors chose to retreat. So not only was there a recurrence, there was no chance that they could get Babesia by exposure because they're still in the neonatal intensive care unit. So they were retreated. And a third baby who was born at 24 months had problems with respiratory distress, intraventricular hemorrhage, which is troubles with the heart, retinopathy, which is troubles with the eyes, anemia of prematurity. But the anemia of a premature baby led to transfusion when the baby was 23 days old and 29 days. And the reason that this one unit of blood went so far is because you don't need a lot of blood for a baby that's this young. And so this Babesia in this one from this one donor was able to be spread to 3 different infants. They were negative for Babesia at day 34, but they were positive at a subsequent day, about 51. So in this case, is that if I pull back and talk to you, is that we have a child, 3 child that were all all three of these neonatal intensive care unit children who the doctors were fortunate enough to look for Babesia, diagnosed Babesia, treated for Babesia. So we back up a little and think about Babesia as a society problem, because we always think of it as a tick leading to Lyme, which gets treated, and it's only the problem for that particular person. In this case, Babesia has a problem in that it's symptomatic for some people, very symptomatic for others, but sometimes the symptoms are not that bad. In fact, some doctors use the word asymptomatic Babesia. The implication is they don't have symptoms. Now, I've been in practice for so long, is that sometimes doctors don't always notice the relevance of some of the symptoms, because for years they always said Lyme disease was nothing but the aches and pains of daily living. Recently, they've shown these symptoms are far worse than the aches and pains of daily living. So I always think Lyme can be more devastating than one thinks for some people. Babesia is the same thing, is that even though it has that term asymptomatic, I often find in my practice people with Babesia clinically, and they get on a doxycycline prescription, amoxicillin prescription, but they can't get over it unless they take something for Babesia. I typically use something called Mepron, which is a trovacone, although more recently I use the trovacone in the pill form called Malarone, and that is 1/3 of the dose. And I combine it with Zithromax because I'm always concerned that Lyme or co-infection might be in the same tick. So asymptomatic, I have my doubts. I always like to look a second time, make sure that patient is well. I'd like to go through a couple other things that came up in that particular article that I thought was quite useful. The authors came to the same conclusion I might have come to, which is that you have to have a high degree of suspicion for Babesia in a neonatal unit, that the clinical manifestations and lab abnormalities that you see in neonatal kids is often the same as you see with Babesia. I find the same thing in adults. You have to have a high degree of suspicion in adults and adolescents to make sure there's no evidence of Babesia. I should point out that many doctors rely on sweats, sometimes air hunger, in Babesia. But I don't trust sweats. When I look back at a different article, only half of the Babesia cases had sweats. So I still always want to make sure that we don't overlook that Babesia is out there. It's become even more relevant because a recent study, 40% of people with Lyme are said to have Babesia. And that's such a high percentage that if people do well in doxycycline, great. If they don't do well, a 40% risk is a high enough risk that I want to make sure that I don't overlook Babesia. You'd be surprised how often in my practice that treating for Babesia is what's the missing link. It's not intravenous. It's this Babesia treatment, which is oral. The other thing that came up in the article is they gave a little more information about the donor. The donor was a 24-year-old healthy male from Central Connecticut. He was deemed suitable for donation by the American Red Cross, and his serology was negative for all the FDA mandated tests. He was not this was not the first time that this young man had donated blood. So they didn't give us any information about whether he donated any other blood with Babesia. But the fact that the American Red Cross thought he was suitable meant that we have to be concerned with Babesia in the blood supply. And I'm not alone. There's plenty of people in the government, plenty of scientists trying to figure out, can they detect Babesia in the blood supply before someone gets Babesia? They suggested that the screening questionnaires are not sufficient These were the authors from the Yale study. So it would probably help to have a questionnaire. Probably is going to be helpful to have better tests. And they're working on tests. And there was a paper recently that's in one of my All Things Lyme blog where Babesia was showing up in patients in areas besides the Northeast United States. And in those cases, they tracked the blood down and they tracked the blood and were able to find Babesia was contracted through blood because blood crosses state's line. It goes into other locations. And so every facility has to make the decisions how to handle their blood. So the authors of this Yale study said that medical centers may request confirmed Babesia negative units for their patients, especially the most susceptible patients. So they said that the hospital, that is Yale, where the following cases occurred, have changed its policy. They say that 100% of our units are confirmed Babesia negative. Now, of course, that's a problem because if you do too much screening, it might compromise the amount of blood that's available for life-threatening procedures, life-threatening illnesses, and life-threatening injuries. So in that chapter in the book, I raised 3 questions, and I'm sure as a listener you'll have your own questions. One is, what are the consequences for infants if Babesia was not detected by thick smear by that pathologist? Would they have found it by PCR? Would they even order the PCR? So it was very crucial in this particular set of 3 infants that a pathologist saw the Babesia in the red cells. The second question I came up with that I thought was useful is, would longer initial treatment have prevented a relapse of Babesia in infant 2? Like, nobody's really worked out how long one should treat Babesia. So I think there'll have to be some better studies, bigger studies, looking at what's the ideal treatment to treat Babesia in the first place, and also to prevent a relapse and prevent the need to retreat. And the third question, how can donors be sure their newborns are clear of Babesia after the parasitemia is cleared up? That is, once the thick smear clears, once the PCR clears, how can you be sure that Babesia is gone? In Lyme, having a positive antibody to Lyme, we're never completely sure the infection is gone. There's no test to say Lyme is gone, but there's also no test that we can be absolutely sure Babesia is gone. So I think that if you look at this case, you can see why I picked this, because it has a lot of relevance to the blood supply, to my patients who have Babesia, to reinfections, retreatment, and that I thought I'd share with you. There's plenty of articles ahead that that I'll be talking about. There are plenty of articles in the All Things Lyme Hangouts, All Things Lyme blogs that I've been writing. But I wanted to do something else. I wanted to shift over to more of a Q&A format. Is that there were a number of questions that came up at the end of the last Hangout, which happened to be on Babesia. So I wanted to go through a couple of those just to address those. Are the transfusions using ozone or oxygen therapy? I think that they're still trying to work out what to do with alternative approaches, trying to figure out if that would help. Right now with Babesia, it's typically more of a parasite treatment. I don't understand why the infant wasn't treated with a positive test. In that case, we were dealing with 2 cases where the mothers were pregnant. They were in the 3rd trimester, were treated for Lyme, but there is no accepted treatment for Babesia. It's not even clear one should treat for Babesia. But in hindsight, it makes us wonder, should we have treated during the 3rd trimester? But because there's no protocol yet for treating for Babesia, in the third trimester, the baby didn't get treated. Now, when they had a positive PCR for Babesia after being born, I would have considered treatment, but that's the doctor's judgment. In this case, the PCR positive turned out to be a precursor for parasites in the red blood cells within a few weeks. There's a question: as an infant, how would they expect it to show symptoms? That's what I addressed a few minutes ago. Is that you don't see symptoms in kids that young. You don't see them in adolescence half the time. You have to be very careful with your history as you get older, trying to sort out what's normal and what is illness. This one is quinine is also considered a poison. Somebody read or used quote poison. Now, quinine has been used for Babesia, but quinine has so many side effects. The reason Mepron came along is because it had much fewer side effects. And when they did a comparison study with an author named Krauss and his colleagues, they were able to show that Mepron had the same benefit in a case series as quinine without the side effects. So this one is, I was wondering if children who are born with Babesia, what would be some of the symptoms to look for? Again, symptoms aren't so visible, but would they show low bilirubin? I don't think it's clear with this neonatal unit as to how you can differentiate the findings of Babesia and the findings of being a newborn in a neonatal intensive care unit. This one has, as I was concerned for my niece as well. If she was born with Lyme, Bartonella, Babesia, would this cause her to have anemia? There's so many causes of anemia. Is I think if a tick-borne is considered on the differential of a of someone ill, one has to be concerned that there's more than one infection of a tick. So you have to make sure that you look at Lyme, but you have to make sure you also include anaplasmosis, Ehrlichia, and Babesia in your treatment plan. I'd like to shift again. These were some questions from my last hangout. So I'm going to look at some of the comments that might be in here from today. Hello, Dr. Cameron. I've had Lyme disease for 20 years. I've just been diagnosed. Do you think that at this stage it would be beneficial to try intravenous antibiotics? When they first described Lyme in a chronic form, it was called chronic neurologic Lyme by Legigian and colleagues. That included Steer, the man who discovered Lyme, wrote the first paper up with Lyme. They were sick 14 years when they entered that study. The Columbia trials supported at the NIH, they were sick for 9 years. So I think if you've been sick for 20 years, you certainly should look at whether to treat a second time or even a first time. And I wouldn't typically start with intravenous because so often there's some pills that are quite effective. So I would try those first if you think that a tick-borne illness is part of the story. The other thing I should mention is, and why this hangout's important, is that a lot of times if you go back to the history of someone who's been sick for a long time, they might have been treated for Lyme at one point, but not for Babesia. So this type of hangout, even though it's newborns, it does remind us to revisit our own history or our son's history, our daughter's history, and look a second time at whether tick-borne is part of the story. Hi, Dr. Cameron. I've read about several couples who both have a tick-borne disease. Do you think they both have come in contact with a tick? Could it have been sexually transmitted? It's very hard to do those kind of studies because couples spend so much time together in outdoors, or they have pets that are indoors. They do things together. So they've been looking at whether there's other ways of transmitting, including sexual. But as an epidemiologist, I think the design is not so easy. Now, since I only see 2 questions on this feed, I think that some more questions may be coming in later, and if they are, put them in the comments section. I'll try to get to them the next Lyme Hangout. Also, I have a couple of questions that came up from the social media that I work with. One is on a Facebook post, and that's my Facebook post, Daniel Cameron, MD. Why do you keep using this offensive term? They're referring to post-treatment Lyme disease syndrome. Why do you keep using this offensive term to many in the Lyme community? I enjoy your articles, but not going to share one with post-treatment Lyme disease syndrome. What they're referring to is, my concern is that post-treatment, they've proven that they're sick, and they've been sick for months and years, which is helpful. But the term post-treatment is meant by some people to mean that the infection is gone. They call it a post-infectious sequelae. There is no test to say Lyme is gone. I don't like post-treatment Lyme disease syndrome because there's always a concern about, is the infection still there? From my Instagram account or Instagram, someone responded to a cause study. I gave a quote that from a study that called an economic study in 2006. Quote, for patients less than 15 years of age, we assume that their parents, usually the mother, had to take time off from their work to take care of them. Their mother's value of lost days was included. So in this case, there were people concerned with the cost. In this case, the child was explaining that there are other costs besides the mother's loss of work. In this case, the child's loss of some of the educational opportunities that they had or educational experiences that weren't factored. Like if you have troubles as a child getting well, it's hard to get a good education. It's hard to complete school. It's hard to be successful and get in the schools you want to. And that's a cost that probably wasn't factored into that original economic study. But I certainly know kids that education is challenged. Now, I'd like to tell you about the next Lyme Hangout. I will be addressing post-treatment Lyme disease syndrome in detail, but the case I'm going to start out with is a brand new article. It's a 24-year-old girl who was in severe pain and is still in severe pain in a wheelchair, preparing for removal of 4 molars. So the article goes into the severity of her pain, the difficulties managing pain, the challenges that the pain clinic had to prepare for surgery, and some of the troubles that happen in trying to control the pain in the recovery room and the intensive care unit. And that will lead off the next Lyme Hangout. The next Lyme Hangout is in 2 weeks, and I'll be making those announcements. And that particular article with the molars is not in this book. This book does, Lyme disease takes on medicine, does address post-treatment Lyme disease, does address my concerns with the terminology. So if you really want to read that particular story, you can read my All Things Lyme blog, or the Lyme Hangout will have that particular posting to allow you to read it. So I can look back at this particular Lyme Hangout, and I'm certainly happy to have joined you this evening, joined you both to discuss Babesia and neonates, but really discuss where I'm trying to head with the live Lyme Hangout. And so for all of you who've been joining me, Thank you for your patience as we work out the details, how to get the most out of a Lyme hangout. You're working hard to get better. You're working hard to understand Lyme. Working hard. I'm working hard. We're all beat up at times, but by looking at the science, at looking at what researchers are doing, we can build our knowledge base and help us better understand Lyme disease, not only for those we personally know, but just as a society. It's a fascinating, challenging problem. The book Lyme Disease Takes on Medicine means that Lyme disease really gives medicine, gives all of us a run for your money. So thank you very much this evening, and till the next Lyme Hangout. Have a good evening.